We go to the next topic.
Yes, sir. I'll present next, sir.
What's your topic?
Iatrogenic complications in anesthesia, sir.
Okay.
Iatrogenic complications in anesthesia. Iatrogenic complications in anesthesia refers to adverse effects or complications that are inadvertently caused by the anesthetic procedure or the actions of the anesthesia provider. These can range from mild to life-threatening conditions and can occur in preoperative, intraoperative, and postoperative periods. The anesthesia provided includes general anesthesia and regional anesthesia. General anesthesia complications, preoperative complications, inadequate pre-anesthetic evaluation, missing comorbidities, like undiagnosed cardiac or respiratory disease, unrecognized difficult airway because of inadequate preoperative airway evaluation. Allergies to drugs, if not documented, can lead to allergic reactions and anaphylaxis intraoperatively. Drug reactions. In pre-medication side effects like benzodiazepine doses may be sensitive to in elderly and can cause over sedation. Adverse reactions to antibiotics can occur if not documented preoperatively. Patient misidentification or site error, uh, wrong administration of anesthesia to the wrong patient or a wrong surgical site or inadequate verification can lead to adverse outcomes. In intraoperative complications, these includes airway management issues like airway trauma, laceration to lips, tongue, or gums, and due to difficult intubation or during laryngoscopy, and esophageal intubation due to misplacement of the endotracheal tube. Dental trauma, most common upper left incisor, which is common during laryngoscopy and intubation. Aspiration of the gastric contents, tracheal stenosis or injury, which can result from trauma or prolonged intubation. Cardiovascular complications, hypotension may occur post-induction, hypertension can occur, intraop arrhythmias, myocardial ischemia, and myocardial infarction can occur, and cardiac arrest due to anesthetic overdose or poor oxygenation can occur. Respiratory complications include hypoventilation or apnea, bronchospasm, laryngospasm, and hypoxia, and barotrauma or pneumothorax. Drug-related issues like anaphylaxis, malignant hyperthermia, drug errors like wrong drug or wrong dose administration, and drug interaction with polypharmacy can occur. Equipment or monitor errors like ventilator failure, monitor non-function, and breathing circuit disconnection or obstruction. Diathermy causing burns can also occur. Positioning injuries. Due to inappropriate positioning, nerve injuries can occur, most common being ulnar, common peroneal, and brachial plexus nerve injuries. Compartment syndromes can occur in lithotomy or lateral decubitus positions. Pressure sores can occur. Eye injury, failure to provide proper eye padding or protection can cause corneal exposure and ulceration. Hypothermia is seen in elderly or neonates most commonly due to inadequate warming, and toniquets, when used incorrectly, can cause skin and soft tissue damage and dislodge deep vein thrombosis and produce muscle and nerve ischemia. Intraoperative awareness can occur in inadequate plane of anesthesia. Postoperative complications, respiratory complications like airway obstruction, residual sedation or apnea, aspiration pneumonia can occur, basal atelectasis can result. Cardiovascular complications like hypertension, myocardial infarction, and arrhythmias can occur postoperatively also. Neurological complications like delayed emergence, postoperative delirium. In elderly, postoperative cognitive dysfunctions, awareness under anesthesia can also occur. Postoperative nausea and vomiting. It is common and distressing side effect and can lead to dehydration, electrolyte imbalance. Postoperative shivering and hypothermia can occur. Postoperative sore throat or hoarseness due to endotracheal tube damage and injury to the vocal cords. Regional anesthesia. In regional anesthesia, the preoperative complications include inadequate assessment. In inadequate assessment, failure to identify the difficult spine may lead to multiple attempts. Failure to recognize contraindications like coagulopathy or infection at the local site can lead to adverse outcomes. Drug allergy like Local anesthesia allergy, drug allergy, or adjuvants added to the anesthesia allergy should be documented. Lack of informed consent to specific regional techniques can also lead to adverse patient dissatisfaction. Intraoperative complications include the technique related causing failed or partial block, intravascular injection of local anesthetics leading to local anesthetic systemic toxicity, and high spinal block can occur leading to hypotension, bradycardia, respiratory paralysis. Nerve damage can occur due to needle trauma or needle pressure. Epidural hematoma or abscess can occur, especially in patients on anticoagulants. Autonomic effects like bradycardia and hypotension due to sympathetic block, and nausea and vomiting due to hypotension or vagal stimulation can occur. Total spinal anesthesia can occur, usually caused by accidental intrathecal injection during an epidural attempt. Can lead to respiratory failure, loss of consciousness, cardiovascular compromise, paralysis, and cranial neuropathies. Postoperative complications, neurological complications like prolonged motor or sensory block, persistent paresthesia, postdural puncture headache after spinal or accidental dural puncture, and spinal cord injury. Infections like meningitis and epidural abscess from poor asepsis septic conditions can occur. Urinary retention, usually after subarachnoid block or epidural blocks, backache, and hematoma formation, especially in patients with anticoagulants, may result.
Any problem with plexus block or nerve blocks? Iatrogenic problems?
Inappropriate site identification.
Hmm.
And proper injuries can occur, drug errors can occur, local anesthetic systemic toxicity can occur.
Yes, that is the very important thing that we have. So, of course, you can classify, because this is not a classical answer which we get in the textbooks. So you have to design your answer in such a way that you can either classify them as pre-op, intra-op, and post-op complications, and complications specific to general anesthesia and regional anesthesia. And the regional, again, you can classify them under central neuraxial blockade and peripheral nerve blockade or plexus blockade. So that will be the subheadings under which you can describe all these things. So you have, I think, covered almost all the points, and